My name is Smeralda Dumazil, and my group mates Ty Van, Victoria Jones, and Kayla Almonte will be discussing malaria. The overview is the introduction of malaria, pathogenesis, diagnosis, treatments, prognosis, and public health issues.
First of all, we're talking about what is malaria. Malaria is a serious disease caused by the parasites of Plasmodium. They are found in a female infected mosquito of the species Anopheles. It is transmitted to humans by the bites of the female mosquito, and it is really common in Asia, the Pacific region, and mostly in Africa. So, what is the Plasmodium? Plasmodium is a single-cell parasite which accumulates malaria pigment. There are 5 types of Plasmodium causes the disease in humans. Plasmodium falciparum, the most dangerous, causes the most deaths in Africa. Plasmodium malaria, Plasmodium ovale, Plasmodium vivax, Plasmodium nuglae. And this is the life cycle of malaria parasites. The female infects mosquito by a human and injects the Plasmodium parasite into the bloodstream. It goes to the human liver, and by the time it becomes major, it goes back to the bloodstream and invaded the red blood cell. After a while, it will be multiplied in the red blood cell until the red blood cell will burst and release more parasite into the bloodstream. After that, it goes through the heart and arrive at the end in the lungs. There is a way to transmit from human to human due to the blood transfusion of the one who got infected by the malaria or the mother to child transmission to the damaged placenta. This is the rare situation. And due to the injection, steering the needle contaminated with the blood has infected, and it could not spread like a regular cold or flu or from like the casual contact. So the question is, what is the most dangerous Plasmodium parasite? The answer is C, Plasmodium falciparum.
Pathogenesis is the process that explains how a disease develops. It includes the symptoms, signs, progression, how it affects the organs, and the complications. There are 2 types, uncomplicated malaria and severe malaria. Uncomplicated malaria diagnosis is given when there are symptoms, but there are no signs of deteriorating vital organs and/or severe infection. The symptoms can last from 6 to 10 hours and reoccur every second day. Some strains last longer or have mixed symptoms. This can form to become severe malaria if the host has a poor immune system or if malaria is left untreated. Severe malaria diagnosis is given if there are signs of severe infection or vital organ dysfunction. This can become life-threatening without treatment. Uncomplicated malaria symptoms include vomiting, fever, chills, headaches, fatigue. Sometimes seizures occur in younger people and switching between having the sweats and normal temperature. Severe malaria symptoms include impaired consciousness, fever, chills, weakness, fatigue, repeating convulsions, heavy breathing and respiratory issues, abnormal bleeding, decline of vital organs, clinical jaundice, and signs of anemia. People that have the disease can have what is called malaria attacks, which begins with chills, shivering, followed by high fever and end with sweating and returns to a normal temperature. They can experience cycles of these attacks. Disease progression. Once the person is infected by a Anopheles mosquito, the parasites are injected into the bloodstream, traveling to the liver and sexually multiply for 7 to 10 days. The symptoms begin when putative malaria toxins are released and the rupture of the erythrocytes, also known as red blood cells. Like we learned in Chapter 5, pages 34 to 37, red blood cells swell and burst when hypotonic. This is called osmotic lysis. Sometimes the malaria parasites can stay in the liver and they don't form until later, causing recurrence. Once symptoms have formed, malaria becomes more aggressive as more time has passed that it's not treated. By now, the host is experiencing either complicated or severe malaria. Organ/symptoms affect affected. Malaria affects the brain, the respiratory system, kidneys, liver, spleen, heart, and can make it difficult for the body to produce red blood cells. Because malaria affects many organs, this can lead to organ failure and become fatal. Malaria affects many organs and can cause complications, some that are mild and others that are fatal, such as issues with the respiratory system. It can cause fluid to fill the lungs, making it hard to breathe. Blood vessels can become blocked by parasite-filled blood cells called cerebral malaria. This can cause brain swelling and brain damage may take place. Cerebral malaria can cause seizures and a coma. It can damage the kidneys and cause kidney failure. Anemia can occur, resulting in the body not producing enough red blood cells for oxygen supply to the body's tissues. And severe malaria can cause low blood pressure. This can lead to a coma or death. Diagnosis. There are multiple tests to help identify the organisms, such as rapid diagnostic tests, parasitological testing, and blood tests, which can take up to 15 minutes or even days to complete. For the question, when speaking about disease progression, it is known that the parasites are injected into the bloodstream and travel to the liver. What happens once it reaches the liver and multiplies for a week and a half? The answer is C. Putative malaria toxins are released inside the liver and erythrocytes swell and burst. Once the parasites are released into the bloodstream, putative malaria toxins are released inside the liver, which causes the erythrocytes to swell and burst, which is also known as hypotonic.
Now I'll be talking about the treatments that can be used for malaria. ACT, which is an artemisinin-based combination therapy that uses two different drugs for the most effective treatment. The first one is artemether lumefantrine, then we have pyranerdine artesunate, and then last quinine. For treatment 1, artemether lumefantrine can treat the species Plasmodium falciparum and Plasmodium ovale, and it is used for treating uncomplicated malaria. The treatment is given orally by tablet. Some of the side effects include stomach pain, fever, muscle pain, and more. Pharmacokinetics is the movement of drugs in the body, and this drug lasts within 3 to 4 days. For treatment 2, pyranerdine artesunate treats the Plasmodium falciparum species. It can be taken orally or injected into the patient. Some of the side effects include loss of appetite, dizziness, and nausea. If you have severe malaria, artesunate is the #1 go-to combined with another drug like pyranerdine. The pharmacokinetics for this treatment distribute and last for up to 13 days. For the last treatment, quinine is used for the Plasmodium falciparum species. It can be taken orally by tablets. The side effects are nausea, headache, slight impairment hearing, and more. The drug is only effective for 10 to 12 hours because the body rapidly absorbs it, and the rate is slower in elderly than it is in young adults. All of these drugs are meant to kill the parasites or stop them from growing. How it kills the parasites is by traveling into the bloodstream and into the parasite's food vacuole, where it then forms a toxic byproduct that can kill the parasite. Malaria is a worldwide issue and the cause of thousands of deaths per year. The mortality or death rate is about 20% if it is treated for depending on the severity. If left untreated, the mortality rate is 70%. Now, for cure rate, depending on the severity and time of treatment, it is 66%. But if untreated, it is 0% and can get worse if ignored, so it is highly recommended to get treatment. Now for the question, if a patient has severe malaria and has been infected with the Plasmodium falciparum species, what would be the best treatment for that individual? The answer is B, pyranerdine artesunate.
I'll be going over the public health issues associated with malaria. Public health efforts. Despite malaria being considered a rare disease in the United States, its severity has had a massive effect upon the ones that are infected. There actually has been a noticeable drop of cases associated with malaria. Understanding that drop has allowed researchers to weigh in the various prior public health efforts, meaning taking the time to analyze factors such as lifestyle, poverty, and issues of geography. Throughout the years, there have been many efforts put forward to put some control over the spreading. Based on the research of the Institute of Medicine staff, there has been provision of easily accessible and effective malaria therapy as an essential component where high malaria transmission occurs. Control of malaria. The control measures that we are trying to take are more so focused on ways we can reduce the contact of humans and mosquitoes, destroying larvae by further managing the affected environment, and destruction of adult mosquitoes by using insecticides. Zoonotic concerns. Malaria itself has a lot of primates present, but nosy is a type of malaria that infects Old World monkeys and indeed also affects humans. This further causes malaria that is transmitted from animal to humans, coining the term zoonotic. P. falciparum is also known type of malaria that has excruciating symptoms and is more likely to cause severe infections. If not given immediate attention or care, it becomes deadly. Overall, the malaria parasite cannot be passed down directly from one organism to another. The mosquito must be infected, and a bite is what causes the plasmodium to be transferred from one to another in the bloodstream of the bitten host. Is malaria a reportable disease? Malaria is in fact a reportable disease in the United States and its territories. It is a healthcare provider's responsibility to report all known and laboratory tested cases within the United States. Upon knowing of every diagnosis, they are given 24 hours to report the affected person to CDC. Can malaria reoccur? As far as the reoccurrence of malaria, it is possible for the disease to come back after a first time. Plasmodium vivax infection and Plasmodium falciparum represents the two most frequent and severe forms of human malaria. For many victims, symptoms can start 10 days to 4 weeks after infection, but the two kinds of malaria, P. vivax and P. ovo, can relapse at intervals of 3 to 4 weeks. The recurrence in patients with malaria can be caused by a renewed bite from a new infected mosquito, recrudescence, which is a repeated attack of the same disease after survival of it in the first place, and or simply a relapse. Based on the fact that malaria can reoccur, which answer choice best identifies the ways malaria can reoccur on infected patients? The answer is C, renewed bite, recrudescence, and a relapse. Simply because malaria cannot be transmitted from human contact alone. And these are the references. Thank you.